The physician may ask the medical assistant to instill a liquid or ointment into the eye. An eye installation involves the dropping of a liquid into the lower conjunctival sac of the eye. It may be performed to treat infection, soothe irritation, dilate the pupil, or anesthetize the eye during examination or treatment. Medication for the eye may come in the form of ophthalmic eye drops or ointment. The eye drops are usually dispensed in a flexible plastic container with an attached dropper tip. The ophthalmic eye ointment is dispensed in a small metal tube with a small tip for applying the medication. Begin the procedure by sanitizing your hands. Assemble your equipment. You will need non-powdered gloves, the ophthalmic medication, tissues, and gauze pads. Check the drug label 3 times to make sure you have the correct medication. The first time should be when you remove the medication from the shelf. The medication label must bear the word ophthalmic or eye drops. Never place a medication in the eye unless it says ophthalmic or eye to avoid injury to the eye. Check the medication label a second time against the physician's instructions. Also check the dosage ordered by the physician. Careful checking is crucial to prevent a medication error. Check the expiration date. Outdated medications may produce undesirable effects and should not be administered. As you will see later in the procedure, the medication label is checked a 3rd time before the cap is removed. Greet your patient and introduce yourself.
Hi. How are you today? Good. My name is Vicki. I'm a medical assistant for Dr. Murphy.
Identify the patient and explain the procedure and the purpose of the installation to the patient.
Okay. I need to instill some drops for your eyes to dilate your pupils for the doctor, okay? Okay.
If the patient wears glasses or contact lenses, ask her to remove them. Help the patient into a sitting or supine position. Apply your gloves. Choose gloves without powder, as any powder on the outside of your gloves could get into the patient's eyes and irritate them. Prepare the medication. First, we'll focus on the installation of eye drops. If the medication requires mixing, roll or shake the container well. Check the medication label for the 3rd time and remove the cap. Ask the patient to look up at the ceiling. Looking up helps keep the dropper from touching the cornea. It also helps keep the patient from blinking when the drops are instilled. Gently draw the skin of the cheek downward to expose the lower conjunctival sac. Do this by putting a tissue over the fingers of your non-dominant hand and then placing your fingers on the patient's cheekbone just below the eye. Invert the container and hold the tip of the dropper approximately 1/2 inch above the eye sac. Avoid touching the eye or any other surfaces with the dropper, as this can contaminate the medication. Gently squeeze the container and place the correct number of eye drops in the center of the lower conjunctival sac. The physician has ordered 1 drop of xylate in a 1% solution to be instilled in both eyes to dilate the pupils. Don't put the drops directly on the eyeball, as this can be uncomfortable for the patient. Replace the cap on the container. Ask the patient to close her eyes gently and move the eyeballs. This action helps distribute the medication over the entire eye. Discourage the patient from tightly shutting her eyes or blinking, as this can push the medication out of the eye. Instruct the patient to keep the eyes closed for 1 to 2 minutes. Tell the patient that the installation may blur her vision temporarily. If you are instilling an eye ointment, begin by checking the medication label and removing the cap from the tip of the tube. Ask the patient to look up at the ceiling and gently draw the skin of the cheek downward with a tissue to expose the lower conjunctival sac. Gently squeeze the tube and place a ribbon of ointment along the length of the lower conjunctival sac, starting at the inner canthus and moving toward the outer canthus. Be careful not to touch the tip of the ointment tube to the eye or any other surface, as this can injure the eye and result in contamination. Ask the patient to close her eyes gently and move the eyeballs to distribute the ointment. Tell the patient that the ointment may blur her vision temporarily. Dry the eyelid from inner to outer canthus with a gauze pad to remove excess medication. Remove your gloves and sanitize your hands. Chart the procedure. The medication dosage must be recorded as the number of drops instilled. The charting entry should include the date and time, the name and strength of the medication, the number of drops or amount of ointment, which eye received the instillation, your observations, and the patient's reaction. The abbreviation for one drop is GTT, and for multiple drops, GTTS. The number of drops must be recorded in Roman numerals following the GTT abbreviation.